to them at about 8 and 9 years old, and that's what the Men of Distinction program is doing. By the way, the Urban League has a program called Children of the Sun. They're doing the same thing, and they model these programs after programs across the country that the Urban League has. Programs across the country where they are trying to look into the behavior of young black men and reduce crime and violence amongst them. So that's how we got involved in the Men of Distinction. They are doing a lot of things. They're trying to change the behavior of these children so they will not go into crime and violence later in life. I'm evaluating that program at the Men of Distinction, and they're doing great work. I looked at some behaviors that we were trying to, we call them precursory behaviors, that we were trying to affect. We wanted to look at things like how they were doing in school, like dropouts and attendance and academia. And we were looking at things like crime, what kind of crime they may be involved in, how they got along with at home, were they fighting and things like that. And I did a pretest on those children, the Men of Distinction, when they first came into the program. They have been in the program a year now, and I've done a post-test. And we see substantial, significant change in the behaviors of the Men of Distinction. And that's what they were trying to do. I think this program is saying that if we can do this with young black male and affect what we call precursory behaviors, behaviors that happens before violence, we can probably use this model program across the country. So the Men of Distinction program is very effective. We're looking at self-concept and those young men, and it's something that doesn't happen in school. So what we were suggesting that we may have to come up with a different program for certain numbers of our children that the school and the family and the church and all these people are missing. We talked about if that program, Dr. Isabel program, probably a new institution that would catch the young men that are falling through the crack, and that would change this behavior.
Very good. Very good. Doctor, I think in terms of looking at this as a problem and a question, would you say that in terms of the financial resources that were put in that Men of Distinction program across the state, do you think that the state got its money's worth out of that?
More than their money. When I was looking at the emergency room group that came to General, those same young men were coming into General over and over again. A substantial percent of the emergency room population was either these men or the result of what they had done. They were going themselves, but sometimes they were sending other people,
folks,
their wives, their children. So right along that line, it was cost effective. And when they go to jail, it costs a lot of money to keep a person in jail, a lot more money than it does to keep them in school. And so I think for every dollar they would spend on a program like that, I am sure that they would save $10 on the jail and all of its ramification of the crimes that these young men commit. So everybody knows that prevention is better than trying to cure or treat a condition once it happens. I would suggest, and that's what we're going to try to do. We're going to try to get monies and resources from other places to take care of these children. We think it is a diversionary program because you know these children now are coming from a high-risk area, some of the projects, where these children are prime candidates for later life problems. And if we can get to our high-risk problems now, I think we can divert a lot of problems in the future. So the Men of Distinction. But I had said to you earlier that I think we ought to get to them even earlier. So I'm trying to design a parenting program. Now, most of these young men are from teenage mothers who haven't had a chance to have good child rearing behaviors themselves. So I would like to do a parenting program so you can get at these children even before they're born. So I think this when it should happen. Try to change behaviors or affect behaviors even before the children are born.
Very good. And Doctor, you're also associated with a number of other sociological kinds of programs, and one that concerns a conference that's coming up within the next couple of several weeks. Why don't you give us some information about that? I want to make sure we get that in.
Right.